Understanding hormonal imbalance for excessive or unwanted hair.
What are hormones and where do they come from? Endocrine glands, which are a special group of cells, make up our hormones. There are many endocrine glands in the body, with the main ones being the pituitary gland, thyroid, thymus, adrenal, and the pancreas. Hormones are the chemical messengers in the body that travel the bloodstream to the organs and the tissues. They work slowly and affect many of the body's processes over time. Hormones are dominant, and it only requires a small amount of them to cause significant changes throughout the body. Both men and women produce hormones in the same areas, with one exception, the sexual organs. Hormones can regulate our body's passage from childhood to puberty to middle and old age. However, if they are out of balance, hormones can cause a variety of problems.
Let's talk about hormone imbalance. Untreated hormone imbalance can result in serious medical conditions such as diabetes. Imbalance in the pituitary glands causes growth disorders that will require treatment of a growth hormone. Imbalances could be caused by an overproduction of growth hormones, resulting in very serious medical conditions. There are approximately 6,000 endocrine disorders that are caused by hormone imbalance. An imbalance of hormones is experienced at different times during life. As the body changes from childhood to adulthood, puberty is experienced by both males and females, and then women will again experience a change in their life after childbearing years. Hormonal imbalance is when chemical messengers that regulate our body systems no longer function properly. This dysfunction can be an overproduction or underproduction of specific hormones. The primary hormone that causes these changes is estrogen. Now let's talk about excessive hair growth on women. Excessive or unwanted hair that grows on a woman's body and face is called hirsutism. All women have facial and body hair. This hair is usually very fine in texture. The main difference between normal hair, often called peach fuzz, and hirsutism is the texture. However, excessive or unwanted hair that grows on a woman's face, arms, back, or chest is usually coarse and dark in color. The growth pattern of hirsutism is similar to that of normal hair growth in males. The process of excess body hair can be embarrassing, but it's not dangerous. However, the hormonal imbalance that can lead to hirsutism may compromise a woman's health. Why do women grow unwanted or excessive hair? Women develop excessive body or facial hair due to higher than normal levels of male hormones. Male hormones are called androgens, and they include testosterone. All females produce androgens, but the levels normally remain low. Certain medical conditions can cause a woman to produce too many androgens, causing a male pattern hair growth and other possibly unwanted male characteristics such as deep voice. Polycystic ovarian syndrome, PCOS, is a common cause of hirsutism. Benign cysts that form on the ovaries can affect hormone production, leading to irregular menstrual cycles and decreased fertility. Women with polycystic ovarian syndrome often have moderate to severe acne, tend to be overweight, and may be at risk for diabetes, according to the National Institute of Health. Other forms of hormonal imbalance. Other forms of hormonal imbalance that can cause excessive hair growth include adrenal cancer, adrenal tumors, congenital adrenal hyperplasia, and Cushing disease. The adrenal glands are located above the kidneys and are responsible for hormone production. People with congenital adrenal hyperplasia are born without an enzyme that is necessary for hormone production. Those with Cushing disease have higher than normal levels of cortisol. Cortisol is sometimes called the stress hormone. All of these conditions can affect the way the body produces androgens. Individuals may also experience excessive body or facial hair growth if they take any of the listed medications. Diagnosing hirsutism. Doctors should take a detailed medical history when diagnosing hirsutism. Individuals should discuss their medication use with their doctor to help determine the cause of their hair growth. The doctor should order blood tests to measure hormone levels. Ultrasounds or MRI scans of the ovaries and the adrenal glands may also be conducted to check for the presence of tumors or cysts. Treatments for excessive hair. Medical treatment may be required if excessive hair growth is a symptom of adrenal disorders or polycystic ovarian syndrome. Drug therapy in the form of anti-androgen medications and birth control pills can help balance hormone levels. Birth control may also cause the cysts on the ovaries to shrink. These drugs are usually taken as a long-term solution for hirsutism. Partakers will most likely notice improvement after 3 to 6 months of drug therapy. Doctors may prescribe the medicated cream eflornithine to reduce the growth of facial hair. Facial hair growth should slow after 1 to 2 months. Side effects of eflornithine include skin rash and irritation. If an individual is overweight, the doctor will probably suggest that they lose weight to reduce the hair growth. Obesity can change the way your body produces and processes hormones. Achieving a healthy weight may correct androgen levels without the use of any medication. Hair removal techniques. Techniques for hair removal are used for non-medical management of excessive or unwanted hair. These are the same hair removal methods that many women use to keep their legs, bikini line, and underarms free of hair. If you or your client suffers from hirsutism, offer to help them be more proactive about waxing, shaving, and using depilatories. Laser hair removal and electrolysis can also be effective at permanently eliminating coarse and unwanted hair. Laser hair removal involves using concentrated light rays to damage hair follicles. Damaged follicles cannot produce hair, and that hair that is present falls out. Electrolysis is the removal of hair using an electric current on individual hair that dates back over 100 years. Both of these methods are excellent treatments for removing unwanted hair. Several sessions may be required to achieve desired results. Outlook on excessive or unwanted hair. Excessive or unwanted body and facial hair is a long-term challenge. Most women who are diagnosed with hormonal imbalances respond well to treatment through electrolysis or laser hair removal, but the hair can grow back if hormone levels again become out of sync. The condition can be embarrassing and make those afflicted self-conscious. It's important to remember that body and facial hair is normal amongst women throughout their life, but excessive and unwanted hair should be taken care of in a healthy manner. Counseling and support from friends and family can help these individuals cope with the condition. While we have little control over our hormones as we pass through various life stages, we do have enough control over them at certain stages of our lives to improve the way we feel and look. If you feel that yourself or your client may have a hormone imbalance, encourage them to contact a healthcare provider.